Hell, here's the den, Mother.
Manny, you look better already.
I'm still having trouble breathing.
Well, the x-ray showed it was definitely pneumonia.
Huh?
I'm going to put you on moist oxygen. The tent will just be more comfortable in that mask.
Excuse me. You're in the way.
Hey, Caldwell.
Enjoy your morning dip?
Terrific. If you like a place that smells awful, where someone's always screaming.
Sounds like Thanksgiving dinner at my mother-in-law's.
Now I feel worse than before I went in. Morrison won't give me a shot. His blood pressure's low.
You seem a little groggy still. You've already had 2 shots today.
So, hurry up and give me another.
8 milligrams of morphine, please.
Mr. Duffy's been here for 3 weeks. Shouldn't his pain be stabilized by now?
I can't get a handle on how much morphine he needs.
What about Demerol?
Doesn't matter. Still has the same weird reaction. Lately, his pupils go from pinpoint to dilated and sluggish. BP jumps from 90/60 to 170/80. And he's groggy with slurred speech like this at different times during
What
the
about
day.
neurological damage? Medication mix-up?
Believe me, Jack, I've checked out everything.
You're the only reason I'm surviving this mess.
What do you give you, Michael? Quaaludes? Valium?
Not taking anything.
Hey, who the hell are you to go through my stuff? Look, get out of there!
How many did you take?
Not enough.
You know, you'll kill yourself mixing medications of this strength.
Yeah, well, I don't care.
Well, we'll get you through this, Michael. But without these.
No, look, I need those. Hey, you can't just take those away. I need those. Hey, come on! Caldwell! You can't take them away. I need those! I don't care. Get me the hell out of here.
Try to relax, Michael.
What's the problem?
He's climbing the walls.
Get me out of here, Caldwell.
All right, we hear you, Michael. Take it easy. Why don't you reduce the pressure? Let's get him out of there.
My leg's burning up.
The chamber's not making it any worse.
You've got to give me something for the pain.
It's not the answer, Michael. The longer you stay in there, the sooner I can graft.
It hurts too much. Bump up my morphine.
Forget it. You're going through withdrawals because of the drugs you got off the street.
Well, you got to do something.
No, you got to go do something. Go see Charlotte Miller.
I'm not going to your head shrinker.
Michael, it'll help.
I'm not interested, Caldwell. This thing is worthless.
You'll be out in a few minutes, Michael. But you're going back in tomorrow.
Yeah, don't bet on it.
Hey, all ready for your graft today?
Yeah, you're going to use my skin, right?
Yeah, I'm going to take a piece of skin from right here and stretch it right over the burned area.
What I mean is, it's all going to be mine. I mean, no pig skin, right?
No, like I told you before. The only reason we have to go to the skin bank is if the graft doesn't take.
Oh, that's good. Lillian only eats kosher.
All right, don't bring my wife into it.
Man, just afraid you're gonna run out of white skin. You'll end up looking like Gus, a Dalmatian down at the firehouse.
That's a bad tie, Caldwell.
Thanks. When'd you get these?
The legs? I had them since I was a baby.
The spots, dummy.
How should I know? Why, is it a big deal?
Early sign of infection. I'll have to change your antibiotics. I'll need a culture.
Mesopotamia.
Sent to the lab. Hey, guys. How you doing?
A little rough around the edges, but I'm hanging in there.
Lab says that the spots are symptoms of a toxic infection caused by bacteria that's resistant to the antibiotics we've been giving you.
Which kind of infection?
Form of gangrene, Michael.
Gangrene? He's got gangrene?
I'm sure it's not as bad as it sounds. Or is it?
Unfortunately, it hadn't spread beyond the leg.
Hey, Mike, you're the first guy I know who's got gangrene since the Battle of Anzio.
I'm hoping that mega doses of penicillin will knock it down.
You know, that's all you ever do is hope, Caldwell.
Hell, if I can beat an addiction, I'm certainly not going to let a bunch of bacteria get me down. 3 of us came in here together. We're walking out of here together.
Well, it means you'll be spending more time in the hyperbaric chamber.
My favorite place in the whole world.
Yeah, well, That kind of bacteria flourishes where there's no oxygen.
So in other words, if I hadn't been screwed up on the street drugs, if I could have handled the pain and spent as much time in that chamber as you wanted me to, I never would have gotten into this mess, would I?
I don't know, Michael.
That figures.
Clear. Lidocaine, 100 milligrams. 1 amp bicarb, 1 amp epi, 1,000. Excuse me.
Who are you in this stuff, huh?
Again at 20 watts.
Y'all run online on some shit about what a great doc you are? You're so damn cool. Everything's gonna be okay, right? Everything's gonna be fine.
Cut it, Jerry.
All that talk didn't do Michael squat. There's something you peel.
Manny, talk to him.
He's had his time. We were on him for 30 minutes. Fulminant septic shock. The infection overpowered his heart. I'm so sorry.
I think we've reached an impasse. Hi, Bobby.
Bob.
Hi, guys.
Bob. Bob's an expert. Let's ask him. Do you feel we're all made in the image and likeness of God?
Guys, I'm a little too tired for philosophy.
Come on. I mean, hear us out. Hear us out. Okay, some people are born ugly. But you, as a plastic surgeon, you can reduce the size of their chin or their nose so they look better, they feel better.
Yeah, and some people, due to rotten luck, get deformed along the way, and he helps them too, so they'll get stared at in the street.
But now here's the big question. If we're all made in God's image, is it unnatural to alter the way someone looks arbitrarily? Bob?
Really, I think you're asking the wrong guy.
Oh, come on. You gotta have an opinion about it.
No, I don't ever think of things like that. I'm a plastic surgeon. Body and fender man, that's it. I never cut deep. You guys want to know something? All I am is a face. I mean, my face has opened doors my whole life. Whether it was dating or athletics, hell, even getting into Duke. I mean, I look in the mirror and I can't believe what other people see in me. My image of myself is so different. Sorry. Michael Duffy died a little while ago.
That's too bad, Bobby.
He's a nice kid.
Yeah.
Want to get the lights?
Night, guys. You ready for the unveiling?
Like a kid waiting to meet his blind date.
Remember something.
Huh?
The graft's only the first step. We still have plenty of reconstruction left to do.
He's already apologizing. Well, what's the verdict?
Graft's taken well.
Hey, stop patting yourself on the back. Tell me how it looks.
Go see for yourself.
Huh?
Go on. Be prepared for some swelling. It's gonna look like the color in your TV set needs some adjusting.
Doesn't look like much, does it?
Annie, we made a very good start.
Oh. Yeah. I didn't break the mirror, did I?
Sorry I couldn't graft a mustache on you. Looked all over, couldn't find a match.
It's all right. Man, I wish Michael were around so he could see my new poodle. His funeral's today.
Sorry we couldn't let you attend.
That's all right. I gotta get used to this face before I show it to public.
In case I'll let you two get acquainted.
We just came out of Harvard there, Jamie. Just
Don't touch me! Don't touch me, man!
Easy.
You're not gonna do the same thing to me you did to Michael, man. He's burning, man. We're all gonna burn.
Jerry, give me 5
Put it
minutes.
out.
Haldol,
I'm burning.
Take it easy.
Get me out of here. Get me out of here, Manny. Get out of here. Get out of here.
It's okay.
Manny, get us out, man. We're burning. God.
No fire, Jerry. No fire. Let's get upstairs, Stan. Understand, Mrs. Close, that besides Jerry recovering from his burns, what he's also dealing with is something called ICU psychosis.
Yeah, uh-huh.
Because of his pelvic fracture, he's just been lying in bed too long.
Well, I hate seeing him like this.
Yeah, well, so do I. Now, I've sedated him, so he's going to be a little woozy at the ceremony, but I don't plan to keep him on any kind of drugs.
Then you can't do anything else for him?
Well, maybe there is something I can do for him. Maybe the best medicine I can give him is to send him back home to you and the kids.
You mean it?
Yeah, I mean it.
You gonna let Jerry out of here early?
Yeah. Except you got to take care of him.
Oh, with pleasure. When?
Maybe as soon as tomorrow.
Dr. Caldwell, thank you. Sorry.
It's okay.
Can I go see him now?
Sure.
Oh.
Here's the life of the fireman who drives the engine red.
Guys, I can hear you all the way down the hall of my office. This is great.
Hey, this is my old pal, Dr. Caldwell.
Hey. I see the Haldol's worn off, huh, Jerry?
Hey, well, sir, I'm going home tomorrow. And so we having a little celebration. You know, I should have went crazy earlier.
I would like to have a little pop.
Not much of a drinker, Manny.
Not much of a doctor, either.
You're not gonna bust us for this, are you?
I'd say I'm a little late, huh? Besides, the way you two have been treating me, you deserve the hangovers, too.
All right, hey, second verse.
All right.
Here's the life of a fireman who drives the engine red, who shouts to a team of horses. Go ahead, go ahead, go ahead. Hot damn! The fire's out. You're gonna...
This is the only verse I have.
Yep, definitely sleep apnea.
The abnormal loss of tone in the throat causes his brain, heart, and other vital tissues to be deprived of needed oxygenated blood. Unless you do something quick, Mr. Stovall is looking at possible hypertension and permanent heart damage.
That's why I called Bob in for a consult. Should we try imipramine and chlormipramine, or should we flip all the cards and go for plastic surgery?
Thanks for the use of the hall, Linda.
Anytime, we're open day and night.
With his prolonged history, I'd say Stovall's case is too severe to wait around for the effects of medication to wear off. Tracheostomy is a relatively simple surgical solution.
Okay, I'll call his wife.
And I'll set up surgery first thing in the morning. Retractors. Thanks, cutie pie. 2-0 Silk on needle times 2.
Bob, let me ask you a question. Do you dream in color or black and white?
Don't be ridiculous, Victor. Everyone dreams in color.
Really?
Everyone who dreams in color, raise your hand.
Whew. I dream in black and white, 8mm MOS. Like watching an old Lucy show.
Number 22, French cuff tracheostomy, too, please.
Wonder what the fat guy here is dreaming about.
Victor, how many times I got to tell you? Don't talk about the patients. I'm a strong believer that no matter how far under they are, they can hear what we're saying.
Come on, Bob. Watch this. Mr. Stovall, you drink your bathwater. See?
Victor, can I talk to you for a moment over by the X-ray screen? Sure. This is our last operation together, Victor. I don't want you to assist me anymore.
What?
Look, you're a good surgeon. But ever since I came here, you've done nothing but bad jokes.
What do you mean, bad jokes?
Remember your line about Helen Rosenthal and fun bags?
Yeah, that...
When you're not insensitive, you're offensive. So I have just one suggestion to make. Why don't you do all of mankind a favor? Quit medicine, take up your true calling, professional phony.
Come on, Bob. Why...
Read my mask, pal. You're out of here.